that the vaccines that we're using now will be good against both the mutant in South Africa as well as in the UK. Having said that, this is an evolving situation. So what we need to do...
An evolving situation seems to be the key there. This is Dr. Anthony Fauci on the growing concerns about the number of mutations of the COVID virus and the vaccines as President Biden reinstated restrictions for non-U.S. overseas travelers from Brazil, Ireland, the UK, South Africa, and 26 other European countries. Double masking becoming popular among our country's leaders and U.S. citizens wearing 2 masks. Is that the best option? Global health and epidemiology professor Dr. Amira Roess joins us now with more. Good to see you as always. You know, when we hear about these variants, and then we just heard Dr. Fauci talking about it, we know it's an evolving process, but how concerned should we be about the new variant?
Well, I think it's really important to realize that we are still really in the thick of things regarding the COVID pandemic. And so we really are asking people to continue to wear masks, continue to social distance, because there is some emerging evidence that there is a more virulent or more transmissible strain that's now in the U.S., and that may become the dominant strain. And so while we wait to have more people get the vaccine, it's really important that we continue to wear masks and to practice social distancing.
It's almost like how other aspects of this country have gone in the last year, politically speaking. We seem to go to one side or the other. We seem to be going more toward either people want to double down on the masks, go with 2 masks and say this is going to keep everybody safer, or people just shed them all together and are just like, the heck with it. At this point, I'm just going to take my chances. And we're seeing that on both sides of the equation here. With the double masking, does it help at this point in the game?
Okay, so first, it's really important that people wear masks. Wear 1 mask and make sure that you're wearing the right kind of mask, right? No bandanas, no neck gaiters, no masks that have valves. So first, make sure that you're wearing at least 1 mask, good quality. And if you wear the mask, it has to cover your nose and mouth. That's number 1. There is plenty of evidence to show that wearing masks is effective in protecting those around you and in also protecting yourself. And so this is why the message has been and continues to be that we all need to wear masks to protect each other and to protect ourselves. Now, some populations may have a good reason to double mask, and you may notice when you go to your doctor's office or your dentist's office that a lot of the workers there are wearing double masks. They're wearing 2 masks, and this is common practice because they're getting very close to individuals who are outside of their household. Of course, they're patients. And so in those situations, it makes perfect sense to wear the double mask. Wearing 2 good quality masks can provide an extra layer of protection. And this is why those groups are wearing it. Now, if you are, going to a grocery store or a place where it may be difficult to maintain that social distance, then you could consider wearing 2 masks for that added layer of protection. But it is important to realize that wearing that 1 mask is really critical.
Sure.
So at the very least, do that.
All right, don't take your foot off the gas at this point. Let's get back to the vaccine right now. A lot of people have obviously been putting off travel, not just for recreational purposes, but maybe seeing family. A lot of folks haven't seen their family in a year now, myself included. Would love to do so, and people are wondering, if I get that vaccine, how long do I have to wait then before I can maybe go see my parents who are a little bit older?
Right. So in this case, you are going to want to wait until you get the 2 doses, if it's the Pfizer or the Moderna vaccine. And it may be the case that if you wait 2 to 3 weeks after you get that 2nd dose, that you're likely to have that maximum effectiveness, that maximum protection from the vaccine. But keep in mind that you still should wear your mask, and you should practice some social distancing when you visit your relatives, especially the older ones, because while these vaccines are highly effective according to the data, there is still a chance that you could unknowingly transmit the virus, although that chance is very small.
Doctor, I want to jump in real quick, and I want to get your opinion on this quickly before we wrap things up. Obviously, the vaccine rollout has gone slower than just about everybody expected. And if this does get pushed back 6 months or until the end of the year before everybody can get vaccinated, what do you think? More people will be safer because of the vaccine, or we will reach herd immunity before that happens?
Right. So What we know so far is that there seems to be some reinfection occurring. The literature suggests that maybe anywhere from 6 to 8 months after an individual was naturally infected with this virus, they may be susceptible again. And so it will be difficult in the current circumstances to reach herd immunity because you will have individuals becoming susceptible again. And so it really will be important to remain vigilant, to wear those masks, social distance, get the vaccine when it becomes available to you so that you can continue to operate in as safe way as possible.
Sure. Got to keep it safe. Dr. Roess, always good to talk to you. Appreciate your time. Dr. Amira Roess at George Mason University.
Thank you, Steve.
You got it.